Hello, my name's Timothy. I'll be your nurse today. I'm just going to do the Peds assessment. And this is my patient for the day. So you're going to explain to them what you're going to be doing. You're going to be doing assessment of the patient. You want to identify the patient. Since it's Peds, you can either ask the guardian, whoever's with them, what their name, the date, and the date of birth is, or you can ask them if it's a preschooler. So after you do that, you'll match it up with the bracelet that they have on. And now I'm going to wash my hands and pretend I'm putting on wall gloves. I'm going to start the assessment by just looking at the symmetry of everything. Make sure the extremities match up the size of the patient. Make sure that they're growing good. And while I'm doing this, you want to make sure the nails are clean, the hygiene's good. You want to make sure there's no dirt spots on them or just any negligence that's going on within the household. Just make sure the patient's clean and has good hygiene. Next, I want to check all the skin. Make sure that there's no bruises, just no rust spots on the patient. Next, I'm going to check for perla. Make sure the eyes dilate, both eyes. Next, I want to check the head. Make sure that there's no alopecia going on. Make sure there's no lesion, bumps, bugs. I want to check within the ears. Make sure there's no drainage going on. While I'm checking the ears, I'll go ahead and check the lymph nodes. I'll check the preauricular. I'll check on both sides. Make sure they're not swollen or anything going on. And if they are, I definitely want to report it. I want to check the conjunctiva, pull down, make sure it's pink. I want to make sure there's no drainage coming out of the nose or make sure the mouth, the lips are pink. Make sure you want to feel their palate with a clean glove and make sure everything's okay. Make sure the uvula is midline. I'm going to go ahead and check feel of the carotid pulse bilaterally. Make sure they're strong. Make sure the trachea is at midline. Make sure everything's good. I'm going to go ahead and feel the brachial pulse and the radial pulse bilaterally. Make sure they're strong. I'm going to auscultate the apical pulse for 1 minute. After I listen to the apical pulse, I'm going to go ahead and do the 5 breath sounds on the front. Make sure there's an equal rise and fall with them. I'm going to go ahead and move down to the abdomen. I want to look, listen, feel, and make sure that it's not distended or anything going on. And I'm going to listen and see if it has any bowel movements going on, or bowel sounds going on in all 4 quadrants. And then you want to ask if they've had a bowel movement. And then if they have, you want to ask what it looked like. If it was hard, soft, runny, asking if they voided, make sure they peed, and ask them what it looked like. Then you'll want to document each. Next, I'm going to move down to the femoral pulse bilaterally, popliteal pulse bilaterally, dorsal pedis bilaterally, and posterior tibialis bilaterally. Make sure all the pulses are strong. For a neuro assessment, I want to make sure that they're acting right with the stimuli. With me assessing them, make sure that their findings is like what you're saying, that they're reacting to how they respond to you. And you want to check their mood. You want to make sure that, how a kid acts is how a kid's supposed to act, not scared. You want to make sure they're making good eye contact. Make sure they're not, looking off to the person that's in the room, making sure that, they're not scared to let you know what's going on. So next, I'm going to want to check the capillary refill. That's for the cardiovascular assessment. Make sure the cap refills good in the hands and the feet. You want to get them to do active range of motion or passive range of motion in all four extremities. So you can set the patient up. You want to check for spinal alignment, make sure the spine is straight. Or when you do spinal alignment, you can do it when you check the gait. And you can get them to touch their toes. So next, I'm going to do the 5 breath sounds on the back. I'll get the patient to turn over. While I have the patient on their back, I want to check for any bruises, make sure that the child hasn't been beaten, or if there's anything going on back here, I want to make sure. And I'll run back over. I'll ask them if they need anything, and I'll hand them the call light, lower the bed, and wash my hands, and I'm done.